Hello and welcome to MOTH News. Now, today we are going to be talking about something that cuts right to the heart of families across Ireland, the quality of care in our hospitals, our nursing homes, and the systems meant to protect those we love. If you've been watching MOTH News, you'll know how badly broken they all are. All year we've been speaking to families, people like Anne Gallagher, whose husband Brendan died alone in Mullingar Hospital. We heard from Michelle Walsh, who saw her mother mistreated in a nursing home run by a multinational provider. We've tracked TICWA reports, whistleblower testimonies, and the lived experience of ordinary people who found themselves fighting a system instead of being supported by it. So, as part of our government end of year report card, we're grading the state on health and care. And let's just say the results aren't great. In fact, they're a D in healthcare. Now, I've given them a D in healthcare. This is very, very, actually, I've given them a D or a D plus. Hadn't decided, obviously, when I pulled that graphic together. I think that's very generous. But, it's more, let's think of it as a primary school report card, and we don't be too hard on the poor little children because they clearly don't know what they're doing. We also give them an F in public accountability. Anyway, to discuss what this actually means or where we are for families, for residents, for patients, and what needs to happen now, we're joined by someone who has been at the forefront of advocacy for years. And all of those guests I spoke about, I mentioned in the intro, were lined up and organised by Majella, Beattie from Care Champions. I believe Clare Champions is a newspaper or something. Majella, how are you? And first of all, I want to say thank you for all your support throughout the year and for supplying us and introducing us to all those people we interviewed. I mean, some shocking stories, but, important stories to tell,
Absolutely. And thank you so much, Keith, for giving everybody a voice. Many families get great comfort just from somebody listening and knowing that their story is told. So we very much appreciate that.
Yeah, God, no problem. Really, I mean, I say happy to do it, but my eyes have really been opened in 2025. I think I came into 2025 like some sort of naive, hopeful, innocent, and my my eyes have been opened and my opinions have been changed. So yeah, it's been good. It's been a learning curve for me as well. You're very welcome back. Obviously, you've been on with us before. So we've given the government a D for health and care systems in our end of year report card. Does that feel fair to you, or are we being very, very generous?
I think overall you're being quite generous. I think, to be fair, that there are certainly some things that work really well in our system. Like our mammogram system is really, really good. Anybody who's called for a mammogram is up nearly within a week. If you go in with our injuries units around the country, they're really, really good. So there are some little things that work really, really well. But there's major issues across the health service that's very badly broken. You look at CHI, it's the gift that keeps giving, with the one controversy after the next. And then there's not a week that goes by where we don't have a hospital apologising for a premature death of a person, be it through negligence or delayed diagnoses or whatever. Even this morning, this of a baby. During the week, I think we had 3 young people, CHI and UHL, where families were in court looking for justice and answers. So I feel that the health system chooses not to learn. It suits the system not to listen to those with lived experience. When something dreadful happens to your loved one, you expect that the system is going to be there to support you. You've lost somebody you love greatly and they suffered when they shouldn't have, and they should still be here. You expect that the help board, like you expect the HSE, when you go complaining or looking for answers, you are expecting, because we're all human and human nature, we don't like to see anybody suffering. But what you're met with is with a closed door, you're met with a wall. Then you start going to government, you start going to your TDs, and you're met again with stone walls. It's nearly like the person that you're advocating for. They want to sweep them under the carpet. They want everybody to forget about it. And it doesn't matter how much they break you in trying to keep that from coming into the public domain. That appears to be the experience of the families that we support. And that's wrong. And not only is it wrong for those people who have been horrendously failed, so much so that their families will never be the same and it will be intergenerational, the damage that has caused. They're not learning. You know, these words were, oh, we'll take learnings from this or lessons have been learned. They're not learned. They're only using words and they won't be learned until they bring families around the table to change policy, to be at the heart of change. And, you know, I think fundamental and systemic changes need to happen. And I think we need a major clear out of our systems. There's something, there's such a power imbalance in how everything works in healthcare. It doesn't matter if we're talking about hospitals, nursing homes, down to home care. It's the power imbalance that's a major problem. You know, you can't expect a 70-year-old lady to take on the power and might of a private nursing home when her husband's failed or something has gone wrong or they've given wrong medication and it caused X, Y, or Z. And in the same way, you can't expect a young bereaved family to take on the power of the HSE when somebody dies in questionable circumstances within the HSE. So automatically, there's a massive power imbalance, and most people, we are in a cost of living crisis, but most people don't have money in the bank to go out and get the best solicitors in the country. Most people, in that moment of severe grief, apart from the personal trauma that they're going through, they don't have the at their fingertips, like all these systems do. They don't have the power to get all these people to come into their corner and fight. And we just completely, every single year, I'm sure I'll be sitting here next year, hopefully, and we will be talking again. And we will be talking about similar scandals that has broken within the next year. And it continues. And until we get I actually think a really good example, you know, we had a report out 3 weeks ago on a lady who died in Wexford Hospital who had, she had been denied, there was a flu outbreak last Christmas. This lady went into hospital last Christmas and she died just in the early days of January 2025. Now, every time we raise COVID and we look for an inquiry, you will see the Taoiseach and you'll see the Taoiseach standing up, talking about how much we've learned, how far we have come, and how great lessons have been learned. And in fact, even last night on the Virgin Media Tonight show, there was somebody there from the HSE talking about, you know, all we have learned from the pandemic and talking about the flu epidemic that's here at the moment and the crises. There's visiting restrictions in 12 hospitals today. In January 2025, there was a flu in Wexford Hospital. They shut down visitors. They denied this family in day after day after day. This lady the family was told she was improving. The family knew she wasn't. She was very ill going in. In the end, and they moved her around the hospital. I don't know why this is. We had this right through COVID. They have a thing of like musical chairs, taking a person and moving them around. But this lady died on her own. She was told, the family was told hours earlier, not doing too bad at all. A couple of hours later, I'm really sorry, your mother's passed away. You can all come in now. All brought in after she had died into a ward full of people. So, like, if we can't even get the basics of getting care partner legislation in place, it is the easiest piece of legislation to bring forward to see people as human beings, not as a medical condition, an age, or a disability, but to see people with a right to family, to see people with a right to have somebody to support them to communicate, somebody who will recognise that a person with dementia is in pain or is suffering and is able to advocate for them and also take pressure off staff. Because when there's a flu outbreak or there's a viral outbreak, automatically you're going to be even lower numbers of staff. So to have a person, a family there to take care of this person is going to take from the workload of staff. You know, there's nobody who will lose more when infection control policies fails than a family member, because they will lose the person they love. So nobody's going to take more precautions and follow the precautions that are in place than a family member. The same as in Northern Ireland, 2020, the height of the pandemic, the Buhin Care Partner, it did not increase COVID numbers. And ultimately, when services opened their arms to it eventually, they were so grateful for it and have come out saying how well it worked. And yet here we are in 2025, locking people down. Don't see them as human beings at all.
So it's happening over the border in like on the same piece of land, and we're still not going for it. Do you? So my suspicion is, and this is just my suspicion, is that they don't. When they lock down, it seems to me, I'm like, I'm not sure this is about flu. I'm not sure this is about. I think this is about they don't have enough staff. They're not investing enough in the facility. There isn't enough care being given to this is just my because there's no transparency. You have to kind of you come up with your own theory, because the care partner thing that that points more towards that as well. Like, they do not want people in when they're not investing in staff, they're not investing in the facilities, and they do not want people in there having a look at what's actually going on. And you've got patients in there who can't advocate for themselves, who don't speak up, who aren't well, who they can get away with, not feeding them. I mean, we've had people on talking about, like, the dad being in the care home and coming in at 2 o'clock in the afternoon, the curtain's still closed, his breakfast is cold on the locker beside his bed, he hasn't been fed, he can't feed himself, and they're not allowed to come in and help with that. Well, they can during visiting hours, but it's all those stuff, and you're going, this points towards a lack of transparency, these organizations not wanting people to be inside at certain times because they are not investing the money they're making. If you look at the French company, we're making a lot of money out of this. A French company not allowed to do business in France and making a lot of money in Ireland, and then the government allowing them to do this by, like, who is, apart from the shareholders of the companies who own some of these private care homes. I don't understand why this is the case in hospitals. I'm not really sure. This is just the government, but it all comes down to protecting yourself. You got to follow the money. Who's making money? Also protecting yourself, and it goes back to that thing of protecting reputations and protecting. And I suppose money, because you don't want to, lawsuits, and you don't want to be sued. All of that comes way before, way on top of the list of actually doing what they're supposed to do. Hospitals, care homes, be they what they're supposed to be doing is minding people, and the minding of the people is way down the list, because up here you've got shareholders, you've got protecting reputations, you've got damage, you've got people looking to you've got lawyers involved as well, advising on saying nothing, and lack of transfer. There's so much that up here on this list, with the care of people way down on this list, and it's so broken that it's not even that when things go wrong. So many things go wrong. They're making so many mistakes. So it's broken. It is not working. It's not fit for purpose. Hospitals aren't fit for purpose. Care homes aren't fit for purpose. Then on top of that, when those things go wrong, they try and cover up. Like, they're putting so much effort into keeping it broken. It's costing money, taxpayer money, to keep these systems broken. It's absolutely bonkers.
Absolutely. And, just on that last point, if they didn't spend so much money trying to keep the system broken, if they were more transparent, you wouldn't have families running to court, because that's the only way they can get answers, And, definitely there is an issue, the eyes of a family member is safeguarding eyes for everybody in a time that we don't have proper safeguarding in the country. But there's so many questions. There's moral questions to ask. Like, how many times we hear of somebody with dementia or somebody with severe disabilities who are in an A&E on a hospital trolley, and they're automatically put into incontinence wear because there's no staff to bring them to the toilet. It's stripping people of basic dignity. And, I know myself, you would nearly want to be dying before you would go into a hospital. You were afraid to go in case something dreadful happens to you. Apart from the indignity and, you know, maybe being stripped on a corridor, or not, like the poor gentleman that was reported on last week that died in UHL, where he had been on a special diet, and he died, and the report came back that there was food caught in his throat, and that he wasn't meant to be eating that food. Um, and
And
nobody
we hear
knew
that a
how
lot,
he
don't
got
we? We
it.
hear that a lot of like special diets being ignored in care homes, medicine not being given out, even though the family are very diligent. Because the strength here we have is families, you know, wives, mothers, children, nephews, cousins being the carers, right? And being so diligent with the medication, with the food, and knowing so much about the patient that they're so vital to this patient's well-being. So they should be brought into the. It just makes sense.
Yeah, it's I think when you look at a care home, particularly private care homes, they are run on lower staff.
Mm.
There is a,
So there's more money being made. So the shareholders
yeah,
get more money. There's bigger dividends.
yeah. So like you will have care workers, and we would often get phone calls from care workers. What they have to endure, they can't physically be three people. They are one person, and they are trying to do the very best that they can. They mightn't have the supplies that they need, or they have no experience in care, and they think they're doing a great thing taking on this job, and there's already a poor culture in the facility to take the
Mm.
job on in. So they are learning bad practice from the outset,
Yeah.
not intentional or
We know
whatever.
the train. We know the training isn't up to scratch, and isn't. You know, there's
Yes.
problems with training as well. And I should say it's good that you're saying this because we're in no way blaming the
No, it's not.
staff.
It's not a carer problem,
No.
and you know, I would often even find that when we would put stuff on our own social media pages, where you would have carers thinking that we are coming down on them. We are most certainly not. You know, we have some of the best carers in the country. This is a managerial problem. This is a systemic problem, and this is a government problem because our government and our systems are supporting private business overfunding high quality state run accountable care, and whatever reason that may be for, um it's wrong. You know,
Yeah.
we're putting profit over people, we're putting business over people. And like, even if you look at the report that HICRUP were out this week from Drummond and Nursing Home in Leash, um that nursing home is the one that's been in the court over the last couple of months, where HICWA said that there was a serious risk to life and was looking for the registration to be removed from this nursing home. And even the judge in that case was like, oh, well, can we not have a bit of mediation? Can we not just. And his HICWA was clearly stating that there was a risk to life, that they had got unsolicited information. When they done their inspection, they found that it had been upheld. So there was two court cases. The judge gave them so many weeks to asking HICWA to put restrictions in place for them, and they were to come back in a couple of weeks. Again, the judge was very much falling on the side of the nursing home. And now this court case has been put off until the 6th of January, I think. It's in January anyway. But the report actually came out this week of what HICWA actually saw in that nursing home. So there was a lady stripped naked in a wheelchair in a foyer, and everybody walking past her and complaining of being cold. Now, how many things is wrong with that? There was serious safeguarding allegations that were never followed up on. People were left sleeping in their chairs overnight. They were not put into bed. There was missed food. The list was absolutely endless. That's worse than anything that we have seen on the Primetime Investigates. And in every batch of HICWA reports, when you go through them, it's nearly like people have become immune to it. Unless you can actually look at a screen and see somebody being abused or hurt, it goes in. But if you read it, it doesn't seem to go in. But these are the very same people. These are still our mothers, fathers, our own future selves, because we're all heading in that direction.
Yeah.
And if that's what's acceptable now, if we accept this for the people who are now in care, why should we get any better?
So I mean, I know you are, and I definitely am, and we are in MOTH like quite hard on HICWA, and we're saying, well, they don't have any teeth, they can't actually do anything. And then when you see them trying to do something, and you see the judge trying to come down in favor of the nursing home, and giving them all the time to get their house in order, which they're not going to do. Like they're not going to do anything unless they're threat. Unless their ability to make money is under threat. They're not going to do anything. They're not going to spend more money on staffing. Like I don't know. Is this a culture where judges come down, like judge in favor of the business over the people? Is that like,
Yeah, it's
can a
like
judge not look at this and go, well, this could be my mother, this could be, where's the humanity within the courts?
yeah. You go into a guard station. You could be a staff member or a family member, and you go into a guard station and say, "My mother was abused in X nursing home." 99% of guards will tell you that's a civil matter. That's nothing to do with us. And it's not until somebody will come to us and we'll say, you need to go back, ask for a detective from the protection team. People are going in with very, very serious allegations that most likely have a criminal aspect, or we wouldn't be sending them to a guard station. Um, and guards are saying sorry because guards do not have the skills. They do not have.
The
I remember
training, the
no,
know-how,
no.
yeah.
I remember a case I worked on beginning of last year, maybe the end of the year before, but definitely the beginning of last year, um, where sexual assault had been witnessed by a staff member between two residents. And when it was brought to the guard station, the guard said, well, she's non-verbal. She probably won't really remember anyway. There's no point in doing anything about it. So that's when you have a society that it puts people into different levels of what's acceptable or accountable or how we treat people.
Mm.
Is it any wonder it's across the board?
Yeah, it is. It's like it's endemic, it's systemic. It is how we treat people, and if it's like if it's on the front lines where guards are saying, this isn't really, there's nothing really here, or like, I mean, I don't even, to say that something is a civil matter. So what they're saying is, if you come in and there's been an assault in a nursing home, so that's a civil matter. So what they're saying is, you need to bring privately a case against there's nothing that's not to do with the government or the guard. That's nothing for the Gardaí that. Why? Because it's in a building.
If you go back and we'll say if you have a very serious case, it does go through the protection team and it goes to the DPP. The DPP will in many cases come back and say, I don't think that the victim is fit to be challenged or questioned in court, and they will dismiss it. So, and as a consequence of that, less than 5% of people with disabilities in this country will or have ever succeeded in getting criminal justice.
But
so their rape is not as important as somebody else's because we've not invested in courts and in guards and all the other professionals in between to ensure that they can have the communication skills with a person.
Yeah, they should be able to say, well, look, this person is nonverbal, but don't worry about that. We have ways of
I worked in
that.
Disability is my own background, and it's not hard to teach people. Everybody's able to communicate.
Yeah,
and it's not hard to figure out what somebody is saying in their own way of communicating, and it wouldn't be a huge investment to put in place proper training within all these expert areas in our country that's supposed to be there to protect us, to ensure that it protects everybody, not just everybody except older people and people with disability.
But also, it makes us look stupid and a little bit ignorant to think that non-verbal means non-communicative in this day and age. Do you know what I mean? Like I don't believe our Gardaí are thick, but like that's thick behavior. That's like there's something wrong with you. Like you have a problem communicating, as far as I'm concerned. If you can't see that somebody who's we've seen it. We have family members. We have people who I have family members who have issues around communicating, but they communicate, or non-verbal, or whatever, but they communicate absolutely fine. Everybody knows exactly who they are, knows what their personality is, knows when they're happy, knows when they're sad, knows what they want. They know how. Like it's really sad. It's really sad. And it makes us look stupid and a bit ignorant. And as you say, like, it goes back then to the soul of this country and who we are and what we think of people. And it's a sad state of affairs. So like it's it's endemic. So
I
a couple
think
of
though for
things.
HIQA,
Yeah,
sorry,
go
the
ahead.
the
Yeah,
thing
yeah.
on HIQA, you know, and I'm not trying to dog HIQA really. I think HIQA, they have a tick box exercise. They go in with their inspection, and they're ticking boxes. Um, my concern with HIQA is that people ring with very serious concerns, and they do not appear to be followed up on. I think that was very clearly proven with the Primetime Investigates, when it came out that there was 200 complaints with one nursing home and 40 whatever with the other. Um, that has been the experience of our families. That has been the experience of our staff. That has been the experience of our whistleblowers. When they go and report to HIQA may listen to them. They may take the report, but the behavior continues and nothing seems to change. So I feel, and I mean this with respect to HIQA, I do feel that there needs to be a proper independent audit of HIQA over a certain period of time, be that for 2 or 3 years or whatever, that actually looks at what happens when they receive information that maybe residents are being harmed in X facility or whatever, while they don't have the power to do an individual complaint. Surely they're sending it on to the safeguarding teams. And if they are, why is the HSE safeguarding teams not doing their jobs? Are they sending it on to the guards? And if they're not, why not? Are they sending it on so there needs to be, I think it would probably be I think it would kind of me jumping to conclusion here to stand up and just sit here and say it's all HICWA's fault. But there's a fault that starts with HICWA somewhere. Wherever that
So
fault is, it
so
might
there is stuff they don't have teeth, they don't have oversight, but there is things they can do that they're not doing.
100%. And like, they do have the power to call an investigation once they have the consent of the minister. They very rarely do that. And, you would often see even over the last year, HICWA goes in and closes down a nursing home. And in 90% of the cases, it's over financial issues. But yet they go into Drummond, or they're going into another nursing home where residents are harmed, where residents are being abused, and then it's a big long process and they're going to court, and ultimately the nursing home will still win and be allowed to remain open. But yet they can close one instantly when they go in and there's issues around finances. And I'm not saying that there should be issues around finances, but
No, but
the
we're putting money above people
yeah,
in every single everywhere you look in this country at the moment.
yeah.
That's what that means.
And like, even just on that point, I was we were doing up our end of year report in the last couple of days on Care Champions, and we were making the point that we have a housing crisis in this country. So one solution that the government gave was, well, we'll get older people to downsize. And then when that backfired, well, we'll get older people to take out loans on their house, bridging loans that they'll never be able to afford to pay back, and turn their houses into flats. Older people are not responsible for the failures of Fianna Fáil and Fine Gael. And now we're fighting about the bloody blister packs, and like, which is absolutely criminal if this comes in on the 1st of January, this charge for people who have to receive their medication in blister packs. There are so many danger signs, medical incidents, because people who have a lot of medication, it's going to strip people of independence where they can now manage with their blister pack. Somebody's going to have to come in and do it. There's a huge risk because medication is not going to be rechecked. There will be medical incidents over it. There most likely will be loss of life over it. But people who are on a disability payment, on an old age pension, can afford up to €50 a month for their medication and blister pack.
I mean, how
Well, we've got money for a bike shed, and we've got money for steps to build a few steps and completely spend extraordinary money, like.
but if we need more, like if we look at we have to look at the people, the companies who are running the care homes, say for instance, we have to look at the NGOs, you have to look at the charities, we have to look at the CEOs that we're paying a lot of money. We have to look at like how much it costs to look after a young person once they leave the care system and they go out into the big bad world, because it's all privatized, like 60 grand a year. Like, there are lots and lots of places where we can save money rather than charging people who take medication more money for to make sure that they feel safe taking the medication and that they don't die, basically. And so it just seems like once again we are going to charge the sick, the vulnerable, the people without a voice. And I suppose that's why it's important that you guys are there and doing that work. And I suppose the thing is that it's great to have you guys going into 2026. I mean, do you think that the government actually understands the scale of the oversight gap, or like that with HIQA, or do you think it's been downplayed? I cannot believe that there isn't a judge somewhere going, why do these cases keep coming into, like, why is this happening again? This is something that needs to change. I can't believe there's not a government minister or a civil servant not going, we're getting complaint after complaint after complaint. Something needs to be done. I have even on a personal level, I have a headache dealing with these people. Like, why? I can't believe that those conversations aren't being had.
There are, I think that some people in government, senior government, are very far removed from reality. It was like the old statement of Leo Varadkar years ago, where people need to buy a house and they can't afford it. Go and ask mom and dad. Go and ask mom and dad, like the bank of mom and dad, which isn't in most people's experience. So I certainly do think there is a little bit of a bubble there. I do think that there are individuals within government who do understand, but they are not going to put their head above the parapet. Absolutely, and it is heartening to see opposition really coming out recently, and I'm finding lately with opposition, they're using our language, which is good. You can hear them talking about people's rights. You can hear them talking about, seeing people as individuals. You can see them. I think that's new. I think that's really new in the last year, and I don't, I take a little bit of credit for that within Care Champions, along with other family groups who are going in and who are sitting down, who are giving presentations, and are feeding them. But it's too slow. This is a crisis. The problem is with senior government, there is no accountability. There's no accountability of the Children's Hospital. There's no accountability of the bike shed. There's no accountability for little Harvey. There's no accountability for the thousands of families that we lost and the people who are still being lost. There's no accountability for the people who will die on their own in the next couple of weeks in hospitals because the government have not put care partner in place. And there won't be accountability because it'll be, sure, there were 65 or there were 85, sure, they were going to die anyway.
Yeah.
Even though they might have lived for another 2 or 3 years, and even though their whole dignity was stripped and they were forced to die on their own without any family. I really think the lack of accountability is a massive problem. And I don't know how that's going. Like for Care Champions, we have a number of kiosks. I do feel sometimes that we're getting nearer to some of them. But the bigger issue, I think, that needs to be addressed and dealt with is actually the lack of accountability. If you were given the position of a role of a minister of X, Y, or Z, you're given a hell of a huge wage to go with that. So you take on the responsibility to fix it. Like, you can't be like Jennifer Carr McNeil coming out and saying, well, it's not really my fault. Well, it's your job to fix it, like.
Yeah, the buck stops with you. Yeah,
Yeah,
you've been paid money to take on the responsibility. Yeah.
Yeah, like I could stand up there and say, well, it's not my fault and it's dreadful. Well, I'm not getting a big wage, and she's taken on that responsibility. There needs to be, if you're not doing your job, you need to go.
But do you think that, like, and I don't know where Care Champions can come in here, but I know that there's new families hearing about you all the time, and I know you're probably very busy, and I know you've got your own issues to deal with as well, but it's marvelous work. But like, I wonder, do we and I don't want to put the blame on ordinary Irish people, but we do have an opportunity when it comes to voting for certain people. Like, it's not your job to tell people not to vote for people, but like one of my suggestions, nobody will listen to me, Claire, is that parents decide for one Monday of every month to go on strike. Parents. So they don't do any of the things they normally do, which contribute to society. So they don't go to work that day. They don't do any shopping that day. They do all the things. They hang out at home with their kids or whatever. They don't bring the kids to school that day.
Mm-hmm.
So the parents. So I mean, obviously, if you're a parent and you're also caring, you can't go on. You can't just go on strike. That's the reality
Of
of it.
course, yeah.
But once, like, I do think that parents and family members have power here. And if we were to go like one Monday every month, we do what the guards do with the blue flu or whatever. We all call in sick, and we just don't turn up to do the things because as it is, we're blind. We just keep going. We just keep going, hoping the government will do something about the housing crisis, hoping the government will change what's going on with the children's hospital, hoping the government will change, babies dying and there's no accountability, we're hoping, and we're doing our bit. We're doing the right things. We have a social conscience. We're turning up for work. We're looking after our kids. We're bringing them to school. We're turning up for the Parent Teachers Association meeting. We're doing the cake bakes. Maybe we need to stop because they've stopped doing what they're supposed to be doing. Maybe our part in the contract needs to change as well. And we go, okay, well, you've stopped. Now we're going to stop. And I think that very quickly you'd see it's because that now you're talking money. Now you're talking about people not turning up for work. Now you've got companies going, we can't have this. And I think that to just lay down our tools and not turn up one Monday every month, and I think you'd quickly see changes.
Yeah, I totally agree. I think people would probably be afraid of losing jobs, and people would be afraid of.
You'd need everybody. I mean, in
It
fairness,
would
you'd
have
need
to be
everybody.
everybody. It would have to be everybody. And I don't
And I
think we
understand
actually.
that, and it's the stress that we're under, and that's why that it's handy that we live with that fear, because if we do lose a paycheck, we do lose a job, we do need two people working in every home to pay a mortgage, and that suits the government because then they don't really have to change because you don't have the time to go on strike or to have
Absolutely. And you're
to do
exhausted.
anything drastic.
And you're so
Yeah,
busy battling the wolves from your own door, the cost of
yeah.
living. Like our bins went up again yesterday for the second time in 6 months. There's all these things constantly. They don't have time to absorb the actual enormity of the bigger picture of everybody is suffering like this. It's not just you on your own. You're working all the hours that God sends. You're collecting your children late in the evening from the creche. You're stuck for hours in traffic. And you don't have time to sit down and go through social media and see everything that's happening or to turn on the news. So people are so busy. I do find sometimes, and lately I've started posting some of our videos and new videos that we've been making, and people are coming in. Like I find it particularly on TikTok. Oh my God, that's shocking that this happened. And you're like, well, how long do how long do you have to keep saying the same thing? And
Mm.
what will it take? And it wasn't even just your idea there. I think if all the like-minded family-led advocacy groups came together,
Mm.
I think that would be a powerful voice. We all support each other. We've been at all the Harvey protests and the various different disability protests, and likewise they've come to ours. But maybe what we actually need to do is because I have to say, and it's not because of the people in Care Champions, I think that the people in those family groups are the heroes of this country. I think that they are the best of us. And I think there's power in them, and I think they have the solutions, and maybe that's something we actually need to focus on is maybe in the new year.
This is live. This is live. My doorbell just rang. Hold on, because I want to wrap this up and then let you go. Give me 2 seconds.
Work away.
It's the reality of working from home. I suppose so. I know you mentioned a couple of things there for you. You guys, your plans for 2026. I presume the care partner issue is huge for you. What are you hoping to achieve? What are your plans? What are your big ticket items?
Yeah, well, we're going to obviously really build on we did an awful lot of political work last year, opposition. So we really intend to up that. We've been doing a lot of recruiting lately. So we have extended our team, which is great. So we have somebody who's an expert in politics, in human rights, um, and in PR. So we're really hoping like we'll have our website out in the new year. We did meet with I met with Catherine Connolly when before she became president, and she has given a commitment that we would have our remembrance event next year in the Oris. So that would be a huge event for us. We are in talks with a solicitor about taking a legal case against the state, and I'm hoping that that will actually come to fruition. We have been involved in a lot of research again this year with various academics and various colleges, and we do have a paper coming out in February on the impact of the pandemic deaths. You know, there has been research about the experience of nurses and care staff, a little bit on families, not much. But this is a good piece. It's quite in depth, and I don't think there's any other paper that's like it that's out there. So I'm hoping that would be picked up. So there's loads of bits and pieces happening. We have a campaign going on for family carers at the moment to amplify their voice directly to government every couple of months. So there's lots happening.
Well, look I mean, fair play to you. I meant to mention at the start. Yeah, you hurt yourself. You've got a bit of a bruise
Yeah,
on the
I don't
face
have
there.
dirt in my face. I'm afraid
No,
I
you
had a
okay?
fall. Yeah,
Yeah.
I had a fall. I broke my shoulder and I broke a little bone under my eye. So it's not that I have a dirty face. It's a bruise, but hopefully it'll go down pretty soon.
You mentioned actually. I let you go after this, but you mentioned like mammograms and injuries. That's where we do well. I mean, was that your own personal experience, or like what I wanted to ask is like, what is the difference between how those two very specific areas are do business and everything else,
Okay.
which is just an absolute shit show.
Yeah, well, I can only really talk from my own experience. So obviously, I'm an oncology patient also,
Yeah.
and if I need a crisis oncology appointment, I most likely will be offered something over the phone. Or if I had to go in person, I'll be a number of weeks waiting for it. If I need a mammogram, which I had last, not that awfully long ago, I had an appointment within 4 days. Um, so massive difference. And within 3 days after that, I had the results and backup for the results. I broke my shoulder. Um, I went to the injury unit because that's where the out of hours doctor sent me. They just looked at me and said, "You're too severe," but it just made me comfortable to get to the hospital. I was 20 minutes before I was lying on a trolley. Um, I just couldn't get over, and that was a more rural hospital.
Mm.
Mightn't have the best of reputations in a lot of ways, but I was in A&E for quite a long time, and what I saw was overworked staff who really cared. On the day
Mm.
that I was there, they had a number of deaths, and I saw the real impact on them. But I also saw that there was no support for the staff.
Mm.
You know, they had to keep. I had one young lady who was looking after me, and she came back and her eyes were all red and puffy. And I'm like, "Are you all right?" She said, "We've just lost another patient." I said, "Oh, do you need to go for tea?" "Oh, no, there's nobody to take over." So you have these burnt out people looking after people. But I suppose injury units, like what we were sent to first, we were sent for Scumming. It was extraordinary. People were there like with sprains and whatever. They were in and out and they were home within an hour, sorted without having to take up a space in A&E. Um, and then those who needed to go to A&E were made comfortable. So if you are left waiting, at least like I was given a temporary sling, I was given pain relief. You know, that works quite well, and like
Mm.
it's like
That's
home
all
care.
people can ask for, though, isn't it?
Uh, yeah, it's like home care. They need to break it down, but they need to put the resources in. They need to put the training in, and they actually need to look after the people they're expecting to provide this care.
Mm. Mm. That's it. We'll leave it there. Majella, we'll speak to you again, I'm sure, and best of luck
Happy
and well done.
Christmas.
And yeah, happy Christmas. Well done, 2025, and best of luck for next year.
Thank you so much, and
And
to you,
thanks.
Neil.
Yeah,
Okay, thank you.
thanks for all your help. Good luck.
Bye
Mind
bye.
yourself. There you go. That's Majella Beattie from Care Champions, and they've got a website. website actually next year, I think. But they're on Facebook, very active on social media. Facebook, they've got TikTok, they've got Instagram, and they do amazing work. So go and support them, and tell your friends about them, because it's the more people that know about it, the more people that know about their work, and the more people that get involved. We're stronger together. So let's do what we can. Although it's not our job, but let's do what we can for 2026 to make the experience of people in Ireland, make them feel cared for. Those who need our care. Okay, have a good day.